Today, more tools than ever are available to prevent HIV. You can use strategies such as abstinence or not having sex, never sharing needles, and using condoms the right way every time you have sex. You may also be able to take advantage of HIV prevention medicines such as pre-exposure prophylaxis and post-exposure prophylaxis. How can I prevent getting HIV from sex? Choose sexual activities with little to no risk. You can get HIV from sexual activities that don't involve contact with body fluids, semen, vaginal fluid, or blood. Use condoms the right way every time you have sex. Condoms are highly effective in preventing HIV and other sexually transmitted diseases, or STD, like gonorrhea and chlamydia. Condoms provide less protection against STDs that can be transmitted through sores or cuts on the skin, like human papillomavirus, genital herpes, and syphilis. What are the main types of condoms? There are two main types of condoms: condoms used externally and condoms used internally. An external condom, sometimes called a male condom or just a condom, is worn over the penis during sex. An internal condom, sometimes called a female condom, is used in the vagina or anus during sex. It's a thin pouch made of synthetic latex product called nitrile. HIV can't travel through the nitrile barrier. Take PrEP. PrEP, or pre-exposure prophylaxis, is medicine people at risk for HIV take to prevent HIV. Decide not to have sex. Not having sex, also known as being abstinent, is 100% effective way to make sure you won't get HIV through sex. How can I prevent getting HIV from injection drug use? Never share needles, syringes, or other drug injection equipment. Don't have sex when you are high on drugs. If you do share needles, syringes, or other drug injection equipment, use bleach to clean them. A disinfected syringe is not as good as a new, sterile syringe, but it can greatly reduce your risk for HIV and viral hepatitis. How can I prevent transmitting HIV to my baby? Get tested for HIV as soon as possible to know your status. The earlier HIV is diagnosed and treated, the more effectively HIV medicine will prevent transmission to your baby. You should also encourage your partner to get tested for HIV. PrEP may be an option to help protect you and your baby from getting HIV while you try to get pregnant, during pregnancy, or while breastfeeding. If you have HIV and take HIV medicine as prescribed through pregnancy and childbirth, have a suppressed viral load, and give HIV preventive medicine to your baby after giving birth, the chances of transmission HIV to your baby are less than 1%. After delivery, you can prevent transmitting HIV to your baby by feeding your infant with properly prepared formula or pasteurized donor human milk from a milk bank. These are recommended if you have a detectable viral load. If you have undetectable viral load during pregnancy and you wish to breast or chest feed, you can discuss this with your provider and make a plan together on the best way to breast or chest feed safely. Taking HIV medicine and maintaining an undetectable viral load during pregnancy, labor and delivery, and while breast or chest feeding reduces the chances of transmission through breastfeeding to less than 1%. If your partner has HIV, encourage your partner to get and stay on treatment. This will prevent your partner from transmitting HIV to you. Who take HIV medicine as prescribed and keep an undetectable viral load will not transmit HIV to their sex partner. PEP, or post-exposure prophylaxis, means taking medicine to prevent HIV after a possible exposure. PEP should be used only in emergency situations and must be started within 72 hours after a recent possible exposure to HIV.